There's a lot of myths with the plant-based lifestyle, and now, especially with pregnancy, and it really is makes it a little more challenging for people who are becoming pregnant or want to become pregnant if they want to embrace this lifestyle because of the myths about the lifestyle and how it relates to pregnancy. And it may be that they either are worried about embracing lifestyle or that they're running across family and friends that are advising them against it because somehow they are thinking that they know something about it. So let's last time that we were together, we did a little fun true or false thing with our audience. I think I'd like to do that again. So, you guys, you green warriors that are watching out there, I'm going to have our engineer Rebecca. She's going to put up a true or false, and it's a myth, yes or no. Type your answers in the comments, and so we'll ask the first question. And the first question is: during your pregnancy, it is said you won't be able to gain enough weight on a plant-based diet. Do you think this is true or false? You can type it in the comments or just think it to yourself, however you want to do it. And then we're going to ask our doctors to answer this question. So, Dr. Fontaine, can you answer that
Gosh, we
question?
don't even have the answer of your people that are watching. So what do
Yeah.
you think? Is it true or false?
Yep. I
So
think that they may be commenting. So
there,
while they're typing it in, and we'll let them cheat
make
if they don't know.
plenty of question. I think I'm going to start a little bit by saying something about what you had said, Amy, at the beginning. I just want to make sure people realize that pregnancy is a normal event in the life of a woman. It's nothing abnormal. Things could happen. Totally agree. But it is normal. So, and if there's anything more important than anything else, is to have a good diet. So the typical American diet, from what I've seen, has a tendency, I love to see those answers, people know, has a tendency to create something that we call inflammation. And inflammation is often this common denominator that will tend to push us toward complication of pregnancy. As an example, diabetes is a good one. Diabetes, high blood pressure. There's many others. So therefore, the false is the right answer. False is the right answer for people that said that you have plenty of calories that you can get into the plant food. And actually, it's the good one. And there is absolutely no problem of gaining the normal weight with a plant food base. Now we can discuss all the other little element, but for that particular answer, I'm going to, just say it that way and give the chance to Jeffrey to give us other option.
Thanks, Elizabeth. Yeah, it's an interesting question to start with because what I think most of us in the medical field are dealing with is that we see patients who are gaining too much weight during pregnancy, starting with too much weight at the time of conception and gaining too much weight throughout. And so this is a lovely problem to even think about because I see it so rarely in the patients that I work with. But for those women who do have trouble gaining weight in general, in first trimester, we talk about eating for two, but when you're eating for two in the first trimester, the second person at the table is about the size of a peanut. So you don't have to have a whole lot of extra calories to eat for two in the first trimester. Actually, there's no extra calories per day recommended in first trimester. In second trimester and third trimester, it's like 340 extra calories per day to 450 extra calories per day in the third trimester. And that's not very hard to get. That's like a basically an almond butter and banana sandwich with a cup of soy milk a day extra on top of what your usual calories would be. And so that's not a whole lot. And you're feeding your body and your baby these delicious and healthy foods and supporting a good weight. So I think no problem.
Yeah. Can I ask and add a little something on that? On the weight gain, I have to admit that for the last probably 15 years of my career, I had stopped to mention to my patient that, you needed to add 300 to 400 calories Because unfortunately, if you know a little bit how much the American, or all over the planet actually, have substantially increased the amount of calorie that we eat per the 10 years, 20 years, and so the majority of people that were sitting in front of me probably didn't need more calories during the pregnancy. So I stopped mentioning this because unfortunately we tend to eat too many calories. So, I would be maybe a little bit more specific on people that would be pretty slim. But I'd be careful on the other population, just to be. And for some people that were significantly overweight or obese, you will often see that they lose weight during the pregnancy. So as long as we see that there's a normal growth of the baby, which most of the time happen, then there's no concern.
Yeah,
Very
that's a real good
good.
point. Real good point. If I could add to that, if we say for an average weight woman, the average expected weight gain during pregnancy is about 25 to 35 pounds. When a woman hears that, says, "Oh my gosh, I'm going to gain 20, 30 pounds of fat during this pregnancy," but it's not that. It's important to think about. So the baby's going to be about 6 or 8 pounds. You gain about 6 or 8 pounds of body fat. Then there's a couple of pounds for blood weight, just from the extra blood that you make to prepare for delivery, and in the fluid in your cells and in between your cells, the weight of your uterus, the weight of growing breast size, the weight of the placenta, and all that adds up. That really the amount of body fat that you gain if you're eating healthily is rather small compared to all the other sources. And a woman who's already starting out at a BMI of 35 or 40, so in the severely obese range, you don't have to gain any weight, because you will probably, if you eat a healthy diet, you'll probably lose a little bit of weight, like Elisabeth's saying, and still allowing for the necessity of placental weight and baby weight and all that kind of stuff. So I think focusing on healthy foods, not worrying too much about how much am I eating the right amount of calories per se, just eating a broad, healthy spread of plant-based foods.
Right. And of course, throughout the pregnancy, the mother frequently visits her obstetricians to get weighed and measured and so forth. So there's monitoring. So if there was any concern, I'm sure the obstetrician would say if they didn't think that they were gaining enough weight, which doesn't seem to be usually the case.
No,
Okay.
joy.
And you both do telemedicine, which we'll talk about a little bit more later. And that is something that if somebody was, especially if they wanted to embrace this lifestyle while pregnant, they could be monitored by you by sending in their vital stats, or even notes from a doctor's visit that they were seeing in their town, and you could help monitor those things as well. Okay, so did you want to say anything else before we
Yeah, I
move?
was going to say that, these women that are followed by the obstetrician, everything is good. It's very important. However, if the physician, which most likely still happen, the physician are not familiar with plant-based and they don't have time, it's fine to have a consultation with one of us in order to discuss how's everything going. Am I okay? Am I eating the proper vitamin or protein, so that we can review that, reassure them. Because unfortunately, and I was there, the majority of the obstetrician gynecologists will probably say, no, not a good time to start any of these things while you're pregnant, or even continue. They'd be concerned. So it's very important that you take time and, continue seeing your OB, but we would be very happy to assist you in order to make sure that the decision on the plant-based is a good one.
Yeah, that's very good to know, because this is when you have someone else's life that you're being concerned about, not just your own. You want to make sure you're doing it right. And obviously, with these doctors that have studied this, and they're very familiar with pregnancy and very familiar with this lifestyle. And basically, it has to be well designed in order to be effective, and they can make sure that you're on track with that. So let's see our next question. True or false? Guys, let's see what you want to say. Eating soy during pregnancy is not a good idea because of the phytoestrogens. That's something that a lot of people are concerned about. So you can type in your answer and take your guess, true or false. And you don't have to type it in the comments if you don't want to. And let's see, Dr. Pierce, do you want to answer that one?
Sure. This came up a little bit last week when we were talking about soy and healthy bones. And, I think initial studies that came out, which I think were mostly based on mice and rats, said, oh, there might be downsides of eating soy with all these plant estrogens, et cetera. But the human studies that have come out, and there are a number of them, show that soy is really good for us in a number of ways, whether you're a man or you're a woman. But in this case, as a pregnant woman, soy is great. It has, as you review this topic and say, okay, what are all the important macronutrients like protein, and what are the important micronutrients that we need during pregnancy, like iron and calcium and zinc and all this stuff. Well, when you look at all these categories, what comes up over and over and over again are the benefits of beans, of legumes, and soy is an important one of them. And it provides legumes in general, but soy as well in particular, provides so much of these categories that it's I think a key part of a healthy pregnancy. So make sure that you're eating soy in the many forms that are close to the form that it came out of the ground as. So either the dry, mature soybeans that you soak overnight and cook like you would pinto beans, or edamame, the green, younger soybeans that you would get at a sushi restaurant, or calcium set tofu, tempeh, soy milk. All that stuff's good. I'm not a fan of adding scoopfuls of isolated protein powder or some soy protein or something like that, because a lot of the good stuff has been taken out. But the basic whole food versions of soy are great for pregnancy.
Yeah, I do love edamame, and I'm able to buy it already shelled and frozen, so I can just spoon some out on all of my salads that I eat throughout the week. And even if it didn't have any dressing on it, I just love the way it tastes. It's very good. What do you want to talk about as far as the soybeans, Dr. Fontaine?
I think Jeff is right on it. When you think about it and you use your common sense, there is so many other food that we ingest that potentially could have impact and negative impact, and we don't even talk about it. The fat that we ingest, the meat, as an example, hamburger, and why suddenly we're downgrading the soy. I think there's probably concern more by the food industry than really the person, the individual, and we transmit this information, goes on social media, and too much information. We become those Google doctor. People come to my office asking me questions that they saw on Google that I can't even keep up with the information that they get. So I think on the one on soya, to me, is a little bit pushed again. It's very healthy, contain a lot of the protein that you're looking for. And I think that it's an excellent type of food to have into your diet.
Okay. Let's talk about our next question. Let's see.
Is there any music or dance that happened between the question or something?
I'd have to ask our voiceover person to do that. Let's see.
No, I think Amy was having a little bit of echo.
Yeah, I didn't hear it, but so throughout the pregnancy, you're going to become deficient in vitamin B12 and folic acid on a plant-based diet. So two things: the vitamin B12, if you're completely plant food based, then it is important that you supplement with a vitamin, or at least making sure that there's sufficient vitamin B12. So that's important. That's probably the one that you cannot forget. During the pregnancy, folic acid as a prevention of what we call neural tube defect, which is, something with the the spine as an example, just to give you. So it's very important that you have sufficient amount of folic acid, which you could get with a plant-based. But when I see women that are in their potential of wanting to, not to get pregnant, I encourage them to take a vitamin that will have folic acid, because it's very hard to know, are they really getting sufficient amount with their diet. If I was sitting with them all day long and I knew exactly what they're eating, they would get sufficient amount of folic acid with a plant-based diet. But since it's hard to tell, I would probably encourage them. But it's really at the prevention is at the very, very beginning. It's before we can even know that you're pregnant. So very early, you got to make sure that you're on folic acid, at least on that.
Yep.
Yeah, the folic acid, that's something that's very interesting.
We can't hear you, Amy, once in a while, so we're going to keep talking a little bit. The food industry had made some huge effort, at least on that. It's very positive to put folic acid in a lot of things that we are eating. They may not all be plant food based, but in order for this prevention and knowing that women could be at risk during pregnancy, so they've add folic acid in a lot of the things that we eat. But again, I would encourage a woman that is not trying not to get pregnant, is not on contraception, I would say, hey, make sure you get a little bit of folic acid in order to help your body as much as you can. Are you back, Amy?
I hope so. I think I may have an echo, hopefully not.
That's okay.
Okay.
What do you want to
Dr.
say on
Pierce?
that, Jeff?
Sure. I'm checking to see if I have an echo, but I think I sound okay. I think something like 40% of pregnancies are unplanned, and so it's not like everyone can say, okay, I'm going to get pregnant and therefore I need to start supplementing with folate, for example. And so I like the recommendation for being on a prenatal vitamin if you are of childbearing age, and that includes the folate, because it's really in those first few weeks before you know you're pregnant that the folate is incredibly important for the formation of the neural tube, the spine, and the brain. And without enough folate, you can have serious spinal cord problems and brain development problems. And that, I see patients in my clinic every week that say, I think I'm maybe 4 weeks pregnant, and you put the ultrasound on and they're 4 or 5 months pregnant. And so it's best to prepare by just being on folate, and that's true for women who are plant-based or not. And then the B12, I totally agree as well with Elisabeth, is that it is found in soil microbes, and that's how cows get it, because they're eating the soil microbes as they eat the grass. But and meat eaters will get the B12 from the cow meat, for example. But even omnivores in pregnancy can have low B12 levels, and so it's important to make sure that you're taking some B12 in your prenatal vitamin. And sometimes, especially if you're at higher risk for being low in B12, to check a B12 level and other labs associated with B12 and see if you need to supplement. I think a common recommendation is 1,000 micrograms twice a week to make sure that you're getting plenty of B12 to support yourself and to support the baby.
Well, very good. Let's see if my mic is working for us.
Sounds great.
I think I may. Thank you.
We're going to take over the show now, Amy.
Well, you don't really need me.
Elisabeth and Jeff show.
Right.
Yeah, we'll make it
with Elisabeth and Jeff. Yeah.
I would love that. That'd be great. Okay. So we were talking about supplements, and I was doing a little bit of engineering in the background here. So did we talk about all the supplements that you're recommending? Did you cover that?
I think the B12 and folate we were talking about.
Right.
I think a lot of the stuff that you need, and sorry to interrupt, Elisabeth, but I'd say a lot of the supplements that you need come in the prenatal vitamin. But not all prenatal vitamins are created equal. One thing that's important to pay particular attention to is iodine, for example. You need something like 220 micrograms of iodine during pregnancy a day. check to make sure your prenatal vitamin has the typical, say, 150 micrograms a day, and then the rest will be brought in your diet. A little bit of iodine in fruits and veg in general, but a lot of the soils are iodine deficient, and so a little bit of iodized table salt if you would like, if you're not SOS free. There's a little bit of iodine in the nori seaweed that you wrap your veggie sushi in, and that's perfect. It's low dose, and that's fine. Stay away from kelp, which has got huge amounts of iodine, and that's probably how I would manage that. You can check iodine levels in the urine. I've never done that in a pregnant woman. I just make sure that their prenatal vitamin has some iodine in it, and they'll probably be okay. And what else, Dr. Fontaine?
Thank you, Jeff. Well, so the other things that, obviously we talked about it last week, we talked about calcium. So it's certainly important to have a little bit more while you're pregnant. Doesn't mean that you have to take necessarily a supplement. Again, the problem is to know exactly how women are feeding themselves. And in the plant-based, especially as an example, there's plenty of vegetable that will provide some calcium, and there's oat milk, and these milk have been reinforced with some calcium, so certainly keep an eye on that. Otherwise, yes, you can take a supplement. And the iron women tends to kind of decrease a little bit that level of iron. It might be by dilution, we call, but iron is a good idea. That the prenatal vitamin, the majority of them contain just a very tiny amount. So even more important that to have a nice and structured, well colored food plate in order for you to supplement. I've seen that the majority of women that would become anemic, which is not enough iron, most people have this kind of North American style diet that really doesn't contain much vegetable, fruits, and therefore we supplement them. And again, the prenatal vitamin does not contain much iron, so sometimes we need to give them iron pill, which has their own problem in itself, tend to constipate. But on the other hand, the women that eat a very nice variety of food with the plant-based will tend to maintain a very nice level. So I was able to maintain my level without taking any vitamin during the pregnancy, because I was very susceptible with constipation, and I said I don't want to take any of that. So just to make sure you eat properly. So that would be probably the four most important. I mean, the whole diet is important, but you think about it, the B12, folic acid, the calcium, iron, and iodine.
Amy, if I can, there's one thing that I've been learning more about lately that I didn't think about in a lot of the years that I was doing prenatal care, and it's something I think that's still a little bit debatable, but is worth consideration, is the long chain polyunsaturated fatty acids. So these are the healthy fatty acids that are naturally found in fish and in algae. In a predominantly plant-based diet, the omega-3 fatty acids that we get are the short chain fatty acids, typically referred to as ALA. And these are in good supply in chia seeds, flax seeds, hemp seeds, in walnuts. And pregnant women, better than men and better than, I guess, probably very young or elderly women, have a better ability to convert these short chain ALAs that we get out of plants into long chains fatty acids, which are important for baby or fetal brain and retinal development, so the eye and the brain, and might have some other effects as well. And so some people say, you're going to get all of the long chain fatty acids by eating short chain fatty acids, and your body will make them into long chain for your baby, and that'll be fine. And other people disagree and say, well, it's probably safer to supplement with some DHA and EPA pills. And from a plant-based or vegan standpoint, those are the ones that come from algae and not from fish. And I think that would be probably the general recommendation, about 200 or 300 I believe, milligrams of that. And I think that's a better way to do it, to get your long chain fatty acids than eating fish, because of all the contaminants that are found in fish. There's some really interesting videos that Michael Greger did on nutritionfacts.org, where he's talking about, well, if you want to cut your your baby's exposure to mercury, it's actually recommended not just to stop eating fish during pregnancy, but maybe to stop a year ahead of time, to let the mercury get out of your body, because it takes a little while. And then for some of the other persistent pollutants, the persistent organic pollutants like PCBs and these other kind of scary breakdown products from modern day manufacturing that are just in our food web, may take 5 or more years to get out of the bloodstream. I just saw some crazy study that said 95% of umbilical cord blood samples in one study still showed breakdown products of the pesticide DDT in America, in modern day America, even though DDT's been banned for decades. So trying to avoid these high fat types of foods like fish, meat, and dairy, where a lot of these persistent pollutants concentrate, might be a good thing as we learn more about this.
Right. I think that they even had a study with the carotid arteries of newborns showing fatty streaks in them from people that were consuming the standard American diet. So now, speaking of fat, there are some people who have adopted a whole food plant-based lifestyle, or they're thinking about doing it. And some people who do this do a low-fat version, especially if they're interested in weight loss. So how would that be when you're trying to become pregnant, or you are pregnant? Is that something that you have to think about? Dr. Fontaine.
It's a good question. I cannot say that I had a review. And again, it's one of those elements that you're discussing that is coming from people that suddenly decide to review Google and get some opinion. Certainly while you're pregnant, it's certainly not a good time to try to kind of quote unquote lose weight. That is not a time that we encourage people to try to do any kind of even more modified diet. So like I mentioned at the beginning, it is important to have a good variety, a good color of fruits and vegetables and beans and fiber during the pregnancy, and drinks a lot of water, which is very important. So in itself, I'd be careful of trying to significantly reduce. It's already questionable for people to say, am I going to have enough fat when I eat plant-based? And then suddenly they're going to try to eliminate. It's interesting as a question. Personally, I think that as long as they are attempting to monitor on the plant-based and have somebody like us to try to help them, that's probably the most secure answer that I can give them.
Sounds like good advice. Dr. Pierce?
I agree. I think that there are vegan diets where, that include a whole lot of added oils and a lot of vegan pastries and a lot of Impossible burgers. And those aren't low-fat plant-based diets. And I would say in general, that's not particularly healthy if you're adding a lot of fats. I think a low-fat, whole food plant-based diet that you see talked about in a lot of the groups, like that we generally recommend, and Physicians Committee and McDougall and Furman and all these folks, is just a healthy diet that comes with healthy fats already built into it. So the healthy fats in olives and seeds and nuts, and the healthy fats in avocado and all that kind of stuff. And so that's fine. And so I think if that's the focus, that should be fine. But yes, being overly restrictive, especially if the goal is trying to lose weight during pregnancy, or try to stay the same weight all throughout pregnancy or something like that, that's where you get into trouble, where you see the bad press with a vegan type diet during pregnancy, I think.
And also on the discussion that Dr. Pierce is mentioning, that sometimes we will encourage people to really have low fat, reducing oil and the fat, because they have a chronic disease that makes us think that this would be the best way to go for them. It's not necessarily, certainly not during pregnancy and wanted to lose weight. It's for people that have cardiovascular disease. We know that their artery are plugged, and we really want to help you to reduce all the risk without having necessarily to go under surgery, so that you can become very restricted. So you got to make sure that when you read, when you take information, that information applied to you, and not on a specific group of individual.
Right. And that's why when you answer these questions, you're answering in general. You're not really trying to give specific advice, because without reviewing the patient's medical history and their profile, you can't give out advice, and it's not just one size fits all for everyone.
Correct.
So it's very good to be in touch with a physician that is familiar with this lifestyle and can target and cater it to whatever your needs are medically. Now, Nadia had a question, because we were talking about low fat. Nadia B says, is it okay to eat totally raw, whole food, plant-based while pregnant? So, Dr. Pierce.
So that's an interesting question. You know, I'm not a specialist in raw food per se. I think that a lot of the foods that you consume raw are totally healthy. So lots of raw veggies, lots of raw fruits. Don't recommend raw beans, not good for your teeth, and all the other problems with uncooked beans, but no one's eating that. You in the literature, or in the sort of stock recommendations for pregnant women, don't eat raw sprouts, and I think that's mostly from a industrial level, that, you know, because they talk about bacteria that can be involved in that. You know, sprouts don't have intestinal tracts, they don't have E. coli themselves, but it's contaminated sometime during the food process. So I think if you're sprouting your own broccoli seeds healthily on your kitchen sink, that's probably okay. You know, if the raw diet involves like unpasteurized juices, that's another one of those stock things where unpasteurized products it can have bacterial contamination, so that's not recommended during pregnancy. You know, when we're talking about eating a healthful diet, if you're getting your B12 and you're getting your D and you're taking your prenatal vitamin and you're getting all the calories and you're getting healthy fats from things like nuts and seeds and avocados, and you're getting the iron from all these things, you know, it seems like most of those things are coming in raw foods, or can come in raw foods. And so I'm not seeing something that's a big hole off the top of my head. Elisabeth, anything I'm missing?
No, I think you got right on the top of the story here. However, what I'd like to add is that if you look at the literature, there is no big study on pregnant women eating whole plant food base, other than what we call observational studies. So there is no double-blind studies. It's always hard to have studies that will allow us to have a complete answer, but at least the observational story and in the literature demonstrate that there's no difference. It is definitely actually even better, with a reduction of some of these diseases that I mentioned earlier, with the preeclampsia, diabetes, and not gaining as much weight. So there's good sense that it's definitely good to have a whole plant-based diet. So what I want to say on that is that if we don't have complete studies on the whole plant food base, it would be hard for us to say the raw, fruits and vegetable. So I think that by, Jeffrey giving this answer, it's to use basically the common sense answer into what was asked. And, as long as you make sure that you have all the proper, micronutrient, macronutrient, then that is fine.
Yeah, I would think it'd be difficult for any person, especially if they were trying to eliminate oil, to get enough calories being totally raw, because cooked food has more calories and it's easier to consume more calories that way. So I always wondered about that just for people who weren't pregnant, much if they were eliminating oil, especially. So we have another question from Alicia. I'm 30 weeks pregnant and congratulations. I was just diagnosed with gestational diabetes. I'm overweight and recently went whole food plant-based. I'm just so confused on what I should and shouldn't eat. Advice?
Cool.
So,
Dr.
yeah,
Fontaine,
it
go
is
ahead.
cool. The first thing I'm going to say is that it's hard to do that by yourself. So, I mean, we can give little advice on this program, but if there's any better reason to say, would you like to be followed, and at least for us to talk a little bit more, I think that being able to go on, our website, take an appointment. There's also the group that we call Mastering Diabetes. They're following pregnant women to try to help them. So, it is amazing for you to make that decision. I'm not sure exactly where you are into the diagnosis. Did they put you on any medication? Did they suggest any other thing? So again, just a quick evaluation is a little bit difficult, but if you eat a good variety of the whole plant food base, it would be good. It's totally fine for you to go on it. But to start that now, I think it would be better to have a little bit of assistance. What do you think, Jeffrey?
Sure, totally. I think when you are, so congratulations, first of all, for going whole food plant-based. I think that's going to be great for you and your baby as well. When you're doing it, when you're not pregnant, you have lots of time to sort of make changes and typically see the results of them. You want to be particularly careful in pregnancy because it's affected, your changes affect you and your baby, and it's also a very short window, and so you have to be careful with the changes that you make. I would say in general, so a big fan of the folks over at Mastering Diabetes. They know what they're talking about. So, you can just search in their podcast for talks on gestational diabetes, look on their blog. A lot of those resources are free, and you can, they're a coaching program, so you could talk to them specifically and pay as well if you'd like for more specific information. Also, you could go to the library or the bookstore and look at Neil Barnard's program for reversing diabetes, I think is the name of the book. But that book and all the other stuff from his group, PCRM, PCRM.org, they have a lot of stuff on their website about a healthy plant-based pregnancy, including stuff that mentions gestational diabetes. But my general recommendation to this sort of a thing, to this situation where you have been diagnosed with gestational diabetes and you're, say, overweight, so probably have a fair amount of what we call insulin resistance, is if you, start on day one eating a bunch of mangoes and bananas and apples and grapes and stuff like that, you'll initially see sugar spikes, which will confuse you and make you think that you've made the wrong choice. And that's just because right now, any kind of sugar, even the healthy sugars that come in fruits, will cause your blood sugar to spike. And so it's really better in general to start heavy on the legumes, the whole grains, and the veggies. And as your insulin and low fat, so minimizing saturated and even unsaturated fats, that you will see your insulin resistance go down, and then you'll be able to increase the fruit intake. But I totally agree that it's good to have someone walk you through this, especially if you make big changes and your pregnancy provider is not fully aware of this. You could see, and they say, for example, have started you on a oral medicine like glyburide or an injectable medicine like insulin, and all of a sudden, though your diet changes so radically that your sugars get so much better, that these medications make your sugar go too low and you get hypoglycemic, which can be life-threatening. And so you definitely want to be walking through this with your own provider. And if you or they need second opinions, you can do it through us or other groups that have specialized knowledge in this.
Yeah, that's just so important. It can be quite overwhelming when you get a diagnosis like that, especially when you're pregnant. There's so many things that you're concerned about. So That was really good answer. Now, this is something I can relate to. Jamie, she's 8 weeks pregnant, and she says she's throwing up constantly. I was nauseous. Fortunately, I didn't throw up, but I can relate to this. So, but her doctor she said her doctor gave her meds. Of course, she doesn't want to take them. So, what should she do? Any natural herb advice? So, Dr. Fontaine.
It's been a while since I've seen a pregnant woman
Mhm.
personally. And I would say that I have tried a lot of different things to try to help them. And the best thing was not necessarily to try any type of herbs, and maybe Jeff has a recipe on that. But for me, was to encourage them to really eat a very tiny amount at a time, and make sure that they hydrate themselves. The baby is very small, 8 weeks. We mentioned that, so they will tolerate very well if you're not able to get the amount of calorie that you want to. And usually the worst timing is usually between 8 and 12 weeks. So if you're able to maintain what I said for kind of recipes, just a little bit at a time, and sometimes especially to be careful of not spending a kind of a 12 hours without anything in your body, because that's usually when the circle kind of keeps spinning, and then you can't eat anything, you keep vomiting. So make sure that even at night before you go to bed, or even something besides your bed, so that you can have a little stomach, something in your stomach in order to help you. So that would be, what I've used most of my career. And I've tried other type of supplement. For me, unfortunately, so much variation. So Jeffrey, go and tell me if you have anything new in the literature.
Yeah, so unfortunately, not something that has totally revolutionized the field. Besides what you're talking about, Dr. Fontaine, I mean, it's uh, a lot of the recommendations center around make sure you're having small, frequent meals so that you don't get hypoglycemic. Because if you're haven't eaten for a long time and you get low, that can trigger some more nausea. Stay hydrated, because sometimes being dehydrated might make you a little bit nauseated, excuse me. The smells, of course. So this is kind of just generalized information. So smells often are a trigger. And so get somebody else to do the cooking, get out of the house in the kitchen if you can during the cooking. Try to eat bland foods. So, oatmeal, toast, bananas, rice, these sort of more bland things during this time. Interestingly, people who are plant-based tend to have less hyperemesis or severe nausea and vomiting or pregnancy than meat eaters, but that's not to say that women who are plant-based can't still have it. As far as herbs go, the most frequently, really the only one that I recommend is ginger in many forms. And so whether it's tea or ginger ale, ginger added to your food, ginger candy, ginger syrup, whatever works for you, that's a natural one that's good for nausea. And I think those are my main ones. I think if you don't want another thing to maybe stay away from a medication if you wanted to, though I think sometimes medications are certainly necessary and you should keep talking with your doctor about it. Some people get benefits from the C bands, from the acupressure bands that put pressure at the wrist, that can help with nausea. And as far as medications go, probably the least worrisome to most people who are hesitant about taking medications in general is vitamin B6. So it's a natural vitamin that we get in our food, but just a higher dose of it. And so for the patients that I'm seeing that have bad vomiting and want to start with something as natural as possible as far as medications go, I would say 25 of vitamin B6 2 or 3 times a day and see how that helps.
And well, at least one thing positive is that the study had been clear on that women that has hyperemesis, they tend to have a much normal pregnancy after. So that's the positive thing to tell them, is that your hormone level may be high and you're not feeling good, but the good thing about it is that you usually it's free of complication, and pregnancy goes well. So can't have everything in this world.
Yeah. 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 And it'll get better, right? It tends to get better somewhere around 15 to 20 weeks, 16 to 20 weeks, something like that. Some women suffer with bad vomiting and nausea throughout all pregnancy, but that's the minority. Most women get better by 20 weeks.
It's funny. I hear you saying that, and I have those memory. I don't know how you are, Amy, but the first trimester maybe was not as bad as some of my patients. But do I remember having those periods of being so sick? So you just listen to that and you say, "Oh my gosh, I almost forgot about those days." But it's so hang on, hang on. Things will get better, and at some point you kind of forget about it. But not an easy time.
No, it's not an easy time. I wasn't plant-based at the time, and I wonder if it would have affected how I felt back then. One of the things that for me, it was, as Dr. Pierce was talking about, this the sense of food, cooking food, or even ripening cantaloupe on the counter. It was just a no thing. But what helped me, and it wasn't anything to do with diet, because I didn't know any better back then, was I noticed that when I was in the car and I had the air conditioning on high, really, really high, like freezing cold, that I'd have to put a coat on, it almost like it took sense out of the air, and it was almost like I was in this neutral zone. I still couldn't really think of what I wanted to eat that didn't make me feel queasy, but at least the scents were, I had a relief, for just a little bit from that.
Yeah.
So maybe it was like kind of like an air filter. I don't know.
I don't know, but it's a good point that not all the treatments are diet based. And two that I had forgotten that are in line with that are, don't take your prenatal vitamin in the morning if that's when you're having most of your nausea. Either hold off on it for a little while or try to take it at a different time of day, like maybe right before bed. And then the other, I have women who tell me, well, when I'm brushing my teeth and I'm brushing the back of my tongue, I really vomit. I'm like, okay, don't brush your tongue. You can skip that. You have a pass from your doctor during this stage of pregnancy.
Oh, but you're absolutely right on that. I almost forgot. I remember a lot of women, even not having the hyperemesis, were very sensitive of taking their prenatal vitamin. If you suggest to take it later before they go to bed, was not as bad. So simple little thing, but that was good to mention that, Dr. Pierce.
Okay. And we were talking about calcium earlier. So Ginger wanted to know, does eating spinach leach calcium from the bones? I guess we're concerned when you're on this lifestyle about calcium, but then you want to eat plant-based. So Dr. Pierce?
So there is a connection between spinach and calcium, but it doesn't leach it from the bone. So spinach is still a good thing to eat. Spinach is what's considered a high oxalate green. And when I think of my high oxalate greens, those are spinach and beet greens and collards. And they all have good amounts of calcium, but they also are high in oxalates, which makes them stingy with their calcium, which just means that when you eat, a couple of cups of spinach, you would get less of that calcium than if you ate a couple of cups of a lower oxalate green, which are all the brassicas, all the broccoli family types, like kale and collards and pak choi and bok choy and arugula and tree kale and all these other things that you can get. And so it's okay to eat spinach during pregnancy and outside of pregnancy, and but if you are trying to maximize your calcium sources, then make sure that you are getting that mostly from things like kale and collards and stuff like that.
Dr. Fontaine?
I guess on that, just to be careful of not trying to unify and thinking at one thing that could potentially have an impact that you've read. Again, if you use the common sense of using a variety of all the vegetable that Dr. Pierce just mentioned, I think that is definitely not a problem. So on that, don't be too specific.
So we're talking about pregnancy, and we're talking about the plant-based lifestyle, and there are so many challenges, and we've kind of mentioned some of them, that women who become pregnant could face, especially if they aren't on a healthy lifestyle, like diabetes or a high blood pressure, or I think you mentioned preeclampsia. That's as a result of the high blood pressure, I think, and maybe even that the child would be likely to be overweight if there wasn't a plant-based lifestyle involved. So What other advantages, Dr. Fontaine, would you say if someone adopted this lifestyle? What are the other advantages that they might encounter that
I
make
guess
it a motivation?
probably the interesting thing regarding this question is as an area that I like to hear about is what we call the epigenetic. So there's a huge impact of the study that demonstrate that what you eat even prior to be pregnant, or even what my mother ate would have an impact on future generation. So I kind of visualize this question because I think we've discussed, a good way of the whole plant food based diet during pregnancy. But it's just to say, not only during the pregnancy, but the impact that you have on eating and good food to your baby and your future generation. So you're decreasing, obviously, your chance of having the risk of certain disease that are related to pregnancy, like you mentioned, Amy, but also thinking about what is it that I'm providing for my future generation, the baby that I'm growing. And so it is such an important moment in the life of our future generation.
Dr. Pierce?
Yeah, I agree. I think there's focus when you read about vegan diets and when you talk to when your family members or the person at the, store gives you advice on being vegan during pregnancy. You hear, being vegan during your pregnancy, you hear mostly the concerns. Oh, you're not going to get enough of this and you're not going to get enough of this. And when you, even though a plant-based diet is recommended in many national organizations in the U.S. and abroad, they talk about just make sure that it's well sort of put together. And so, nobody should be on a celery juice diet for 9 months of pregnancy. That's just, that's just silly. You need to eat a well-balanced diet. And we really should also hold the same sort of standard to the diets that involve a omnivorous type diet, is that you could have a decent omnivorous type diet during pregnancy where you if you want to, if that's what you believe strongly in, to have a little bit of dairy and a little bit of animal products. But that's also not the norm. You see that a lot of diets that are omnivorous, that are the typical standard American diet, are mostly processed foods and high fat animal products and all the problems that come with that. The benefits to a healthy whole food plant-based diet of decreased C-section risk, decreased postpartum depression, decreased neonatal death rates and maternal death rates. And these are tricky to parse this stuff out, but it's been seen to some degree in the literature. Less of the condition called preeclampsia, which is scary stuff, high blood pressure and seizure risks and stuff like that. Less risk for diabetes in pregnancy. Like, these are all one huge benefits that we should be congratulating ourselves for and our patients for and our friends for, and say, hey, congratulations for making this move. You do a couple of things that make sense during pregnancy, and you're going to really increase your chance for you and your baby to have a really healthy time.
Yep, those are really all good messages, and I hope that people will think about listening to a physician that's familiar with this lifestyle instead of, like you said, Dr. Pierce, somebody at the grocery store. Okay, I think we have another question. Alex W., pregnant with leg cramps, advice. Dr. Pierce.
Well, so the only thing I can say about leg cramps is that it is often associated with low ferritin, which are your iron stores. And so in pregnancy, anemia is very common, often most commonly due to iron deficiency anemia. And so if you, what I would recommend is talk to your doc and say, hey, could you order some iron studies, including a ferritin level, and see where that is. Because sometimes supplementing with a little bit extra iron can help with nocturnal leg. I'm assuming they're nocturnal leg cramps, and often associated with restless leg type stuff. And so stretching, a warm shower before getting into bed, taking some iron, magnesium can help as well. That's kind of my general approach.
Did you want to add anything, Dr. Fontaine?
Well, I guess the majority of people would have a tendency to say, "Oh, I don't have enough potassium, and I'm going to eat more banana." But unfortunately, nothing that it's bad. It's good to eat banana, but it's probably not going to save you from the leg cramps. I don't think that there's good studies, unfortunately, on that says that a whole plant-based diet is better than any other diet as far as leg cramps. So, it does happen. It's important, like, Dr. Pierce mentioned, to make sure that you stretch and to prevent, when you're in bed and you have a cramp, please, you do a quick dorsiflexion. That's the best way to kind of try to correct that very quickly. But other than that, it's one of those amazing moments during the pregnancy. And I did suffer quite a bit of that. And that's part of being quick. You kind of wake up the whole bed when you have your cramp. But if you're quick into doing the movement, then hopefully it doesn't last too long.
Maybe you could expand on that for those that are not familiar with that movement to do with their foot.
So when we talk, if you have your foot, because obviously it's my hand, if you're quick to bring your foot right up, what we call the dorsiflexion, it's going to help. So sometimes what happens is that, if we do the other way around, we're pulling the muscle. You're pulling the muscle the other way. It's kind of hard for me. I'm not going to put my foot up into the camera. I don't know if it would.
You don't want to show off.
Okay. So basically, that's really what it is. So you put the foot and you bring it up quickly as you can. Usually, it will reduce the time that you're going to spend into the cramping time.
Yeah, I think I heard it might have been Dr. Clapper who talked about some of the things that you're discussing. And he also said that for some people, not necessarily applying to pregnant women, but for some people, that if they have, especially if they have their sheets and bed linens tucked in, that it could actually push the top of their foot down and make that cramp happen when they're in that paralyzed state of sleep. And so he recommended untuck.
That might be the reason why I've been untucked since my pregnancy. So Dr. Clapper always comes with all these suggestions. I love it. He's so cute.
Oh yes, he is awesome. He thinks about other things too, but he's very familiar with this lifestyle, but he also thinks about the other things too. So it's really cool. Oh, look at that. Our time is just about up. I'm just so pleased that you both came back on. You're my dynamic duo. You could do the show without me, and you did when the light failed, and I thank you for that. It was so fun to talk about such a fun health issue like pregnancy. And I wanted to give you an opportunity to tell the audience again about your plant-based telemedicine and what you could do for even if somebody's not pregnant and they have another health issue, but especially if they're pregnant. So Dr. Fontaine?
So yes, obviously for today, pregnant women, but me, I'm certainly interested quite a bit in women's health, and that are wanted to explore the whole plant food base. So plantbasedtelehealth.com is where you can contact. And I'm licensed in the United States in Vermont, Michigan, Florida, and New York. So that, and obviously international. It's interesting. We can see anybody international. But in the United States, you got to be licensed to all the different states.
Yeah. Dr. Pierce?
So thankfully to be sharing the stage with Dr. Fontaine today and with the other docs in our team at Plant-Based Telehealth, a good group. I'm licensed in California, Texas, and Florida. Happy to see you. I'd like to also put in a plug for the book called Nourish by Reshma Shah and Brenda Davis. A great book for pre-pregnancy, pregnancy, breastfeeding, and raising a healthy family, plant-based. These folks really know what they're talking about. I reference it and recommend it to my patients. And so that, along with the PCRM, the Mastering Diabetes, a couple of great free resources out there as well.
Yeah, we actually had Brenda Davis and Dr. Shaw on a previous broadcast, and we'll put a link to that.
Cool.
And yes, that is just, I wish I had that when I was pregnant. It's not just a good book and has recipes, but it's also a great reference book. So I highly recommend it. We'll put a link to that in the show notes. So if you're thinking about becoming pregnant, or you are, and you want to talk to a physician that is familiar with that and with this wonderful lifestyle that can help you, either contact one of these two doctors, and if they don't service your state, the plantbasedtelehealth.com, you go on that website, they cover all the states and internationally. So you'll find doctors even there that speak other languages too. So I'm really glad that both of you doctors came on today again. It's so exciting. We're going to have Dr. Fontaine back later on for another health issue that we'd like to talk about, and we'll let you know. If you subscribe to Be Green with Amy, you'll find out what that is. But I wanted to thank both of you for being on the show. It was so much fun to have you here, and you're so knowledgeable, and I think that you put a lot of people at ease when they're thinking about adopting this lifestyle, especially if they're thinking about or they are pregnant. So thank you so much. Stay tuned for a special announcement. I wanted to thank Rebecca from PKA Sols. She talked me through my mic difficulties as she was engineering the show, so it was very nice to have Rebecca on as well. And I also wanted to thank Jess from Jess Task Voice. She did the voiceover, the countdown. But most of all, Green Warriors, I want to thank you, because you're here, and that's why Dr. Fontaine and Dr. Pierce are here. That's why I'm here. We want to help you and encourage you to adopt this lifestyle, whether it's about pregnancy or other health concerns that you may have. We want you to have the best information from the top-notch people that I consider really intelligent and well-informed. And I'm glad that you're here. So share, like, subscribe, send the word out to the universe about this lifestyle so that we can help others who are looking for answers. Please, Jess Task Voice, tell us who's coming up next.
Vanessa Mendez, MD, is a double board certified gastroenterologist and internist. She specializes in digestive disorders, as well as obesity and constipation. Join us Wednesday, September 22nd, 3 p.m. Eastern, noon Pacific, on Be Green with Amy, live.
And I want to let you know that if you subscribe, you're going to find out that we actually have somebody coming on before that, somebody that came in the last minute on. It's going to be coming in on Monday, and you'll get to see who that is. It's a really cool guest that we're going to have. So please join me with Dr. Pierce and Dr. Fontaine in saying my tagline, which is be strong, be well, and be green. Type it in the comments and join us together. Okay, until I see you guys again, thanks, Dr. Pierce and Dr. Fontaine. Remember, be strong, be well, and be green.
Green.
Bye-bye.
Thank you.